If you are turning 65 or you're getting ready to retire, you most likely have a lot of questions about Medicare. And it's not just you. Medicare is confusing for everyone. And the more you Google and the more you talk to your friends, the more overwhelming it can be. And so I want to clear some of that up for you today. So when you're turning 65 or you're getting ready to retire, you have a lot of questions about Medicare. And sometimes you don't really want to work with a broker. You don't really know what they offer, or you're nervous about the process, or maybe even you think that there's a cost. Well, there is no cost for my services, for any insurance broker's services. But what I want to do today is make it really easy so we can clear up all of these questions for you, and you don't even have to leave your home. So the first thing you should know is that my name is Stephanie Pogue. I'm a certified Medicare insurance planner. I've been doing this for more than 20 years, and I've helped hundreds and hundreds and hundreds of people through this process. Now, the first thing I like to talk about are the basics of Medicare. We're not going to go through all the boring details, but I want you to understand the basic parts A, B, C, and D of Medicare, how to enroll, if you even need to enroll, some of that information. Then we're going to talk about the differences between Medicare Advantage plans and Medicare supplements, and I'll help you kind of figure out maybe which one's right for you or which one feels more comfortable to you. And then if we were together in an appointment, we would look at your doctors and prescriptions, all the extra benefits, and narrow it down to a specific plan. Now for the basics of Medicare, right? You have A, B, C, and D. Now, A covers anything hospital related, anything inpatient. You're in the hospital, it's covered under Part A, and there is no charge, no premium for this each month. That's what all of your Medicare taxes have gone to throughout the years. It's Part A. As long as you've worked 40 quarters, you're qualified. Now, Part B covers everything outpatient. So any doctor appointments, any lab work, ambulance rides, anything like that that's outpatient, it falls under Part B. Now, there is a premium for Part B. It will either come out of your Social Security check, if you're already taking Social Security, or they will bill you for that each quarter. And it comes from the Social Security Administration. That bill comes from them, but it's for your Medicare Part B. Now, that is original Medicare, A and B. If you only have original Medicare, you're going to pay a deductible every time you go into the hospital, and you're going to pay 20% of everything outpatient. And if you think about that, 20% of everything outpatient, you have an outpatient knee surgery, you have chemo treatments, anything like that, that could be thousands and thousands and thousands of dollars. And there is no cap on your cost if you have original Medicare only. And that's why we really suggest that you have an Advantage plan or a supplement to go along with original Medicare. And the other part of Medicare is Part D, D for drugs. Sometimes you need a separate standalone Part D plan, and sometimes it's included in the plan, the choice that you pick. So we'll go through that a little bit more in a second. Now, Medicare Part C, it's not part of original Medicare. C combines A, B, and D all together into one plan, and it also includes extra benefits like dental, vision, and hearing. These are called Medicare Advantage plans. You don't have to have one, but you have the option. And they are enrolled in separately than Medicare. Now, I mentioned that there's a charge for Part B. It's called IRMA. It's the Income-Related Monthly Adjustment Amount. So if you make more than a set amount each year, and this is based on your taxes, and it's your taxes from 2 years prior. So whatever your adjusted gross income was on your taxes 2 years ago is what they use to base your Medicare Part B premium on. And you can find this information on Medicare.gov. Now, also keep in mind, your Medicare Part B is income adjusted. Your Part D is also income adjusted. And this is through Medicare. It has no bearing on if you choose an Advantage plan or a supplement. So knowing that you want something in addition to original Medicare, you basically have three primary options, not counting Medicaid, not counting VA. Most people will either stay with an employer group or retiree coverage, or you choose either a Medicare supplement, which is a Medigap plan, or you pick a Medicare Advantage plan. And this is where people really get confused because it seems like there's no difference in them, but there really is a difference. Now, both options are good. They both give really good coverage. Neither are perfect. And it really is up to you which one feels right for you. So I'm going to give you the differences. You can either get a Medicare supplement, you keep original A and B no matter what, and the supplement fills in the gaps of what Medicare doesn't pay. So, for instance, the deductible if you go into the hospital, or the 20% of any chemo treatments. Your Medicare supplement would pay that for you. Now, for your supplement, you're going to pay an extra premium in addition to your Part B. Then you have Part D. You have to get a Part D prescription plan to go along with your supplement, pays for your drugs. And then if you want any dental or vision coverage, that's also separate with that plan. Now, the perks of being in a supplement is that you can go to any doctor, any hospital, anywhere in the country that takes Medicare. They take Medicare, they will take your supplement. There are no referrals. There are no prior authorizations unless Medicare requires it. So you really get freedom of care. It's you and your doctor are in complete control of your care, and you can go anywhere you want or need to go. For that, you're paying a premium. Just keep that in mind. Now, your other option is a Medicare Advantage plan. Medicare Advantage plans are managed care. They are usually HMOs or PPOs. And by the way, the difference between an HMO and a PPO, with an HMO, you have to stay in the network of doctors. If you go outside of that network, you pay the entire bill. So you have to stay in the network of doctors. With a PPO, you have the option to go outside of that network, but it might cost you a little bit more. Because with Medicare Advantage plans, you are not paying very much in additional premium. You might pay a small premium, but most likely these plans cost zero. So because you're not paying a premium, you're in the managed care network, you're following their rules, and you're going to pay some copays for all of your services. So when you go to visit a specialist, a dermatologist or a cardiologist, when you go to the emergency room, if you go into the hospital, you're going to pay small bills as you go up to a cap or a limit. It's called your out-of-pocket maximum. So when you've hit your out-of-pocket maximum, the insurance company pays the rest. But up until then, you're paying copays or coinsurance to get to that point. Now, that's not a deductible, but you're paying your copays and your coinsurance until you hit your cap or limit. Now, some HMOs will require referrals, and that means before you go to see a cardiologist, you have to talk to your primary care doctor to make sure that you can. PPOs do not require referrals. Both options may require prior authorizations. And so what that means is if let's say your doctor recommends a shoulder surgery. The insurance company is going to say, well, let's try physical therapy first. Let's try cortisone shots. And then maybe if nothing works, we can do your surgery. So there's no problem with that. It's just something that you should know up front, that's how the managed care or Medicare Advantage plans work. Now, on the plus side, Medicare Advantage plans give you dental coverage. It's included in the plan at no extra cost. They give you vision services, so allowances or money back on eyeglasses. This is where you often find the gym memberships, over-the-counter credits, and lots of extra benefits are included in these Advantage plans at no extra cost. So usually you fall into one category or the other. You really feel drawn to the supplement and the control of your care, and you are willing to pay the premium for it. Or you really like the idea of the Advantage plan, where you pay a very small, if any, premium at all, and instead you pay copays when you use the services, knowing that there's an out-of-pocket maximum, even if something catastrophic happens. So this is where we would normally decide on a plan for you. I look at your doctors, I look at your prescriptions, I look at your lifestyle, your budget, which type of plan are you drawn to? And then we look at the best options. We pick the best plan for you in your situation. Now, you can certainly do all of that on your own. You can check out Medicare.gov. You can call 1-800-Medicare. You can call each one of the health insurance companies on your own to find out what their benefits are. But it is so much easier to use a Medicare insurance broker. We know all of these things. This is our primary job. We look at all of these different plans every day. We can tell you which one has the best dental or which one has the best rating or which one has the lowest costs. You don't have to do all of this research on your own. Let me take that big, anxiety-filled, stressful thing off your plate and just book a call with me. We can do this for you, and there is no cost to you.